Good evening, namaste, assalamu alaikum to all of our viewers in Guyana and in the diaspora. These are certainly troubling times, not just in Guyana, but across the world. Today, brothers and sisters, we have a serious, very, very serious case of the coronavirus disease that has threatened the largest, the smallest, the middle, all kinds of economies are facing serious threats. And that is of small import. Of greater importance is it threatens the life of each and every one of us. In Guyana, we are hit with a double whammy. We have COVID-19 and GCOM 20. So as yet 3 weeks after elections, there has been no results. As yet 3 weeks after elections, most of the country, a lot of the people in the country feel that so far, so long, their vote has not been counted, because as per the injunction upheld by Chief Justice Roxanne George, the declaration ought to have been in pure cognizance of 84.1 of the laws that sets out a public open declaration using SOPs, not some sheet of paper with numbers in it. I think along the process, many people have maybe abused the word spreadsheet, and many people are thinking spreadsheet means a computerized spreadsheet. It is not so. It is a sheet of paper, and today we'll be corrected if I'm wrong. It's a sheet of paper with numbers on it. That's beside the point at this time, because we want to get on to more serious and more troubling matters. So tonight, viewers, we are going to deal with, we're going to have a two-segment program, one looking at the election update, and two dealing with the coronavirus disease. Before we get on with the elections update, I'm honored to have once again Mr. Sanjeev Datadin, a respected lawyer in the Guyana legal system, and also he is a proud member of the PPPC's slate. Mr. Datadin has been on the forefront not just of the elections and events thereafter, but has been on the forefront willing to express his legal opinion. This has nothing to do with his being on a party slate, but his legal opinion on matters that have prevailed since then. To the viewers out there, I wish to remind you that Mr. Datadin is here as a consequence of something that I posted 2 days ago in conjunction with Nohar Singh, and let me say credit to Nohar Singh and Devin Bisoon for this program tonight and the entire Globespan program. But in conjunction and collaboration with Nohar Singh, I posted a challenge on Facebook, and I think the challenge reads that this is an open challenge. Here is an open challenge to the APNU plus AFC and the PPP. An open challenge is hereby issued to one person from each side to join me for a Q&A on the 2020 general elections. Areas for discussion will include but not be limited to SOPs, current legal matters, the declarations, the injunctions, etc. Seats are limited, first come, first served basis. And the format, and I outlined in that post the format of the Q&A session. Mr. Sanjeev Datadin was the first to respond. He responded within an hour, I think, of having seen that post circulated, and he was ready to take up the challenge. From then to now, I would not have heard, and neither did the Globespan platform heard, any uptake of this challenge from the other side. So we are happy to welcome you as our sole guest tonight, Mr. Datadin.
Good evening, Yog. Happy to be here. Good evening to your viewers. Good evening to my beautiful wife. I saw, as you said, I saw that you had put out a challenge. I was happy to be a part of it, to address whatever issues, whatever questions that they are, and also to try to help to get into the public domain what exactly is going on as relates to the election, the various challenges, the process, so that people might have some idea of where we're going, where we're at, and where we hope to go.
Thank you. And to the viewers out there, I haven't asked you this, Mr. Datadin, so my apologies if I'm just throwing this up here. But to the viewers out there, I would like to suggest that for the next 20 to 30 minutes, please send in your questions, as troublesome as it might be, as challenging as it may be. Send in those questions. If we are unable to deal with all the questions tonight, and if Mr. Sanjeev doesn't have the time to deal with it tonight, we can certainly have a repeat and we can have all the questions accommodated, regardless of which side of the fence you are on, whether it's an APNO AFC side, a PPP side, an independent slate side, whatever side you're on, you have a question to ask about the injunctions, about the SOPs. If there's something you will clarification of, please send in your questions. So, Mr. Datadin, I would like to ask you to please educate us. We know there were the injunctions that were upheld and therefore firmly in place by the Chief Justice acting Madam Roxanne George. We also know that subsequently there was the proceedings for contempt that were filed. We don't know much about what transpired thereafter, and then we know that I think a member of the APNO AFC regional slate, I'm not sure about that one, but a member of that party would have then taken the GCOM to court, and the PPP would have enjoined in that process. So, in your own way, you explain to us what's the things preceded, subsequent to the contempt filings.
Well, essentially what happened is the first orders, the orders that were made by Madam Chief Justice, was that there is a statutory provision that directs how a returning officer must total up the votes, how must he tabulate it. The words of the legislation is that he must ascertain the votes in the presence of persons who are entitled to be there under Section 86. And the words of the section are very clear, that he must add it up in their presence. So the persons who are elected to be there are, of course, members of the commission, polling agents, representatives of the various lists, candidates, any candidate is allowed to be there, and of course, any person who is deemed appropriate. Now, the deemed appropriate provisions really refer to the observers, etc., who would have been accredited. The press and the observers would have been accredited before the election as observers. So what that process was is he had to ascertain, which means he gets a statement of poll. All the parties' representatives in the polling place get a statement of poll. There's one posted on the doors or outside the building. You could go take a picture. When he's ascertaining that, he has to say, well, for polling station 411111, my numbers are, and he says, ANUG, AFC, PPP, what his figures are. If there is a discrepancy, then he needs to double check, see what he has to ascertain. But he has to, the words add up are exactly what's in the section. Now, what happened, which was the first one where I was present, is you're right, it did not appear to me to be a computerized printout sort of sheet. It appeared to be a computerized printout sort of sheet, but there was handwriting on it too. Now, what was written or what was not written, I wasn't close enough to be able to see. But that was when the first objection to it all came about. And that stopped. And then what they said afterwards is, we accept that and we will use the statement of polls. We resumed several hours later in the night. We did about 4 or 5, and then the person said that they were tired. They wanted to resume at 9 a.m. There was an objection to that. We resumed again at 1 a.m. We did 4 or 5 again, and then we stopped. And that use of the statement of poll has never resumed. What happened afterwards is GCOM, the officers are purporting to say, well, we are using what we have added up, what we have written down from the statement of polls and telling you. But you see, the legislation says ascertain and add up. Those are the two key things. When that was not being done, contempt was filed. When the contempt was filed, what was alleged is they're not obeying the order. The Chief Justice did not do, contempt proceedings are a little more lengthy. You have to take evidence because they are sanctions. They are fines and imprisonment, which are criminal penalties. So it can't be done in an abbreviated manner like you would other civil proceedings. Right. So the Chief Justice said, let me just help you. And she said, you have to use the statement of polls. You have to show the statement of polls to the people who are entitled to be there. And she would leave it to their discretion, whether they start from the very beginning, which means the 431 boxes that were done are done over, or you continue from 431 and get to 879, because there are 879 boxes, polling stations in Georgetown. She said she would leave that. And that's what would need to happen. Now, what happened thereafter is they took the view that meant the RO can decide how he did the polling up and how he did the issue. But that was not so. So those contempt proceedings were pending. Mm-hmm. What happened was on that day, despite GCOM's commissioner saying that they will abide, despite the CEO Lowenfield saying they will abide, they left court at 12:30, and they continued doing that process until 2 o'clock at a very fast pace. Mm-hmm. And then they wanted to go, and they said they moved the location, they'll resume at 4 o'clock. When they resumed at 4 o'clock, they had what appeared to be the statement of polls, but they were reading from a sheet still. Right. Now, no one was able to examine it. They put it up on a white sheet at 4 p.m. in the day in an open shed with sunlight. Nobody could read what's projected onto that. So they didn't do that. So that was the complaint. But a declaration was made.
So Sanjeev, I just want to clarify something. Based on what you said there, just for my records here, forgetting everything else, the RO basically set a precedent himself by using SOPs for the first 380 boxes.
No, for those first 300 and I think 41 my numbers, you might be right, 380. But what he did is he had the statement of polls then.
That's my point. So he set a precedent.
Yes, of using statement of polls.
Correct. And thereafter he abandoned his own precedent.
He abandoned his process. What happened is at 9 o'clock, he said he would start, 9 p.m., right. And he said he would resume at 9 a.m., despite him saying he would work through. We were all suspicious. Why would he do that? We could have finished it in that night.
Correct.
It could have been done.
That's the point that the CJ, I'm sorry to cut in, that's the point, just for the viewers, correct me if I'm wrong, that the CJ, I think, in the subsequent discussion, literally admonished like she would a school child and say, what's so wrong for you to use the paper and show it, you know? Yes.
Now, there are reasons. I mean, we spent more than 8 billion Guyana dollars for the elections. And I don't know the exact figures, but I do recall from previous elections and this elections, if you look at what it costs to print those statement of polls and those ballot papers, it is an enormous amount of money. A large part of the budget goes to that because it is printed by Canadian Banknote. Mm-hmm. That's a company that prints currency for countries around the world. And the reason why it went to such an organization, such a company, is those ballot papers have at least 6 or 7 security features. They have, like you would find on currency, there's a small line that has numbers in it. All of that is in it, watermarks. And they are, as I understand it, they are 3 forms of protection that not even the commissioners know what it is. Only Canadian Banknote would really know what it is. It is a specific kind of paper. All of these things were done at great expense, and we have a man who just decides to come, and he has undermined $8 billion worth of security by simply making up his own numbers, you know?
Correct.
But following that, while that was pending, the CARICOM initiative came about at the invitation of Mr. Granger. They came in and they said, we're ready to go. They were the shenanigans of whether you need to fumigate, whether you need to do all these various things, but for 2 days it stalled. Following that, an application was made ex parte to a judge. Now, that injunction is to stop that recount, effectively is to stop the recount from happening, and is to direct GCOM to act on the declarations made by Mingo and the other 10 regions and the returning officers in the other 10, and declare, convene the meeting and declare the result, swear the president in. Now, I'm not sure if Ms. Moore was a candidate at the 2020 elections. What I saw and what I have checked is that there is someone with her name who was on the local government. The 2018, I believe, was the local government elections. She was definitely a candidate. I have seen in various parts of the press, and I have seen in various parts of the media, that she was also a candidate in 2020. But I have done some checking myself, and I saw someone with her name on the 2018 local government. But she was a representative of APNU. Well, at that time, she was the representative of the PNC, because remember, in the local government, they kind of went separate ways. But that being what it is, what happened thereafter is GCOM, when the CARICOM people came to Guyana for the recount, GCOM held a meeting and decided to have a recount. For whatever reason they did, it wouldn't matter, because it would be hard to see them resist that the 2 leaders who have 3 representatives each would not vote for a recount. So a recount was undertaken. All the parties were told you need to have 5 people. They're going to do 5 boxes at a time, 1 person from each party. We're going to get going. Now that was delayed, and then a court order came. So what they're arguing about now is making those orders, which are interim interlocutory injunctions, whether they are going to be made permanent, like in the first case.
Question for you. Isn't let me put it in layman's language, isn't one of the interim injunctions, or one of the new injunctions that is inserted in the process, isn't it opposed to a permanent injunction already in place? In other words, from a viewer's perspective, Roxanne George upheld an injunction that says you cannot make a declaration without following 84.1. This injunction is saying, go and make that declaration. Clarify.
Right. Well, what happened is this. The breach has a contempt proceeding pending. So the argument is, or what the APNU lawyers are trying to argue, is that until the contempt is actually heard and determined, they have not breached anything.
Okay.
Now, that's beggars belief, because the reality of the position is, why would an order that is unresolved as to its validity, why would a court compel you to obey it? It makes no sense. But it goes a little further than that. What it tries to do is GCOM has an authority under 162(1)(b) of the Constitution. And the last time I believe we read it, the words are very clear. It used words like GCOM can, in the case of fairness, the word fairness is there, can direct any GCOM staff.
It didn't say FEAR, right? It's FAIR.
Yeah, fairness. It says in anything that they could direct anybody in GCOM to do what they think is right or what they think would make the process fair. Now, obviously, they have already taken the decision to direct that a recount be done. So Mingo has already been directed, although he refused the applications for recount by the counting agent. He's now been directed to do that. Now, it's beggars belief. Why would anyone not want to do that? Now, what happened was Mr. Lowenfield swore an affidavit, and he said that that he's informed. Obviously he didn't witness it. He couldn't witness it. He wasn't there. At least not when I was there. But the position is he's saying that the tabulation took place and the process took place from the statement of polls. So our response to that was very simple. You have sworn an affidavit to say it is taken from the statement of polls. Our affidavits say that it was not done from the statement of polls. So simple. Give us your statement of polls and the issue would be verified without a protracted trial. Because all we need to do is compare what you're saying, compare what we're saying, and you will discover very easily what it is. They have refused that. They said that they will not produce it, that there is no way that that could be done. Those are private documents. But, you know, in 2011, this issue...
But he did it. But he did it for the first 380 SOPs.
Yes. Now, additionally, in 2011, when there was the minority government in 2011, the government of the then chairman, Steve Surge-Bally, was met with the same issue, that you didn't put the votes from the statement of polls, and I believe it was the AFC that was alleging they were robbed in Linden, something along those lines. So they went to the then chairman, Surge-Bally, and they said the arguments were, you know, these are our statement of polls, this is GCOM's statement of polls. So Steve's position was, listen, why would I hide the statement of polls from you? You come, send your man, watch us photocopy it, and we will scan all of it, and we will give it to you. We can't give you our originals because there might be court and similar things going on. But you come here and inspect it as you like, and we will make. And what they did, they published all of the statement of polls so that anybody who wanted it in 2011 had it. Now, once that was done, the figures started to correspond. In the areas that there were issues, it corresponded, and you have not heard very much of that issue. Right. Because what happened was the quarrel about it came to an end. Because it established that there was no chicanery, there was no skullduggery involved. Right. Now, in this current impasse that we have, Yog, how could GCOM take a decision that they will not produce them? GCOM can't operate as they do. They continue to operate as an arm of APNU. They continue to be in a position of obstructionism. I mean, I have known the chairwoman, Justice Claudia Singh, for a very long time, for more than 25 years. And I regret to say that I have lost respect. I never thought that this would be where it was.
So here are some questions for you. And in answering the questions, if you can also, tell us what transpired up to today in the most recent injunctions. Question number one, from Taf Gafoor. Is it within his jurisdiction for Judge Holder to rule that it is legal for CARICOM to oversee a recount? And question two from Robin Fan. Can the judge order GCOM to release SOPs? Your opinion, sir.
Well, the releasing of SOPs is based on a process in the courts. If I deal with the second one first, there is something that when you file a case, if somebody has documents, another litigant has documents that will assist you to prove your case, you can go through a process. It's a mandated process under the rules of discovery.
Right.
So what you do is you ask for them to disclose what they have in their possession. You can only refuse to disclose information if it's privileged, which is usually correspondence with your attorneys. Now, SOPs do not fall into that category. They are public documents. They're everywhere. They're posted on the
posted on the fences, right?
They're everywhere.
Right.
So that is not an issue. The refusal by GCOM has turned into an issue of jurisdiction. Now, whether the court has jurisdiction not to order the SOPs produced, whether the court has jurisdiction to hear the entire matter. Now, that's an odd argument to have come from the applicant and GCOM. Needless to say that the GCOM has sworn, well, not GCOM, Lowenfield has sworn an affidavit which entirely supports the applicant, which is unusual. You're on two opposite sides and you're supporting each other.
Mm-hmm.
So, and their affidavits are consistent with that. But here, what's the issue? They have now raised the issue that the court doesn't have the jurisdiction to do that. Now, they're saying there is the argument that we know that there are matters that can only be raised in an election petition. And the general rule of thumb, the easiest way to explain it is to say all matters that have to do with the count is a matter for an election petition. And all matters that have to do with the actions of the administrators in furtherance of their administrative actions, you can do before by judicial review. So now the applicant is saying that the court doesn't have jurisdiction. It's a strange argument for them to raise, because if they succeed with the argument that the court has no jurisdiction, their injunctions will be discharged. It will fail. The entire case they have brought has failed, which meant they would have lied to the court when they came to get an injunction. They should have disclosed to the court, Judge, I don't think you have jurisdiction to give me what I have. That should have been part of what they should have told the judge. A judge, upon hearing that, would never make an ex parte order. He would invite the other side so it becomes inter partes. So that's an unusual argument for them to make. But as long as this court has jurisdiction, yes, the court can order the production of the statement of polls. That is entirely within the discovery, because Lowenfield has opened a wide door when he said that he saw that this is what it is, and we're saying that's not what it is. There's one way for the court to ascertain the issue. So that's a wide, wide door. Now, the issue of jurisdiction is indeed a troublesome one, because we have raised it as well. Initially, we said that we think the court should consider the issue of jurisdiction too, as to whether they can actually grant the orders that Ms. Moore claims. So when this whole issue of jurisdiction is floating around, the judge has taken the view that he will hear jurisdiction before he hears anything else. And if he decides there's no jurisdiction, all the cases will go. And the only thing that will be left is GCOM's decision.
Right.
And if they go ahead with GCOM's decision alone, then that's essentially what will happen. Right. Now, if we go one stage just short before that, what we had go on was the joinder of various parties into the proceedings. And the joinder of the parties is because what's happening is, the view is an applicant has named 3 respondents, but they're acting in collusion. So essentially what happens is the process is not adversarial. The process is collusive. That in itself undermines the judicial system. So the people who have now joined the proceedings are now fighting the applicants and the respondents, which is In 23 years, I tell you, Yog, I'm seeing a lot of firsts.
So
And this is the
here's
honest.
another question for you. This one is from one of our viewers in New York. I'll quote. Sanjeev, I was wondering how come Roxanne George took over the elections petition case from Navindra Singh on March 6th. Was that legal or politically manipulated in your view? You don't have to answer it, but
I tell you
the
what,
feeling
Yog,
is that.
as soon as these proceedings are all over, I will answer you. I will tell you about it. The reason I don't want to answer is this, and I will be very clear about it. Litigation ensuing, and both of those matters that are in the court are open because of the contempt.
Right.
And it would not be fair to the judges, and it would not be fair to the litigants to have comments about whether it is an issue of bias or any of those things. It wouldn't be fair to them to raise those issues publicly. You know what I mean?
Understood.
Because
Understood.
Justice George is still handling the matters to do with the contempt. Justice Holder is still dealing with the matters that it was. It is interesting, and it should be noted, that the orders made by Justice Navindra Singh, which were interim, were confirmed by Justice George. So he clearly, apparently, got it right, if you want to take so. Good night, Frank. You look all dressed up.
Good night. How are you?
Well, thank you. Thank you for that. Thank you for that, Mr. Datadin. Viewers out there, as you recall at the top of the program, I did mention that tonight we're going to have a two-part discussion. The first part being an update from Mr. Sanjeev Datadin. As you may recall, many of you, I issued a public challenge to any person from the PPP and any person from APNU AFC to come on this program to discuss the matters of elections 2020. And Mr. Sanjeev Datadin responded immediately, and he is here tonight. And we would have gone through a number of very salient points with regards to the elections and where we are. Sanjeev, in closing this part of our program, and of course, you know you're welcome to stay on because we want to move on to the COVID-19 discussion. But in closing this part of the program, if you can, reassess for viewers very quickly and conclude with where we are and what would the next 2-3 days hold for us?
Well, the next 2-3 days, there are a lot of submissions being filed by everybody. There are some affidavits and replies being put in there. But in simple terms, the big issue that should happen is GCOM wants to do a recount. GCOM has invited the parties to a recount. GCOM released a statement this afternoon at about 5 o'clock, as I understand. That's when I saw it, at least, that says they want to do the recount, but they have to, the matter is before the court. Now, as I understand it, the two main parties, the political leaders, have said they wanted to do a recount. All of the small parties say they want to do the recount. I am not sure how the court will take a view that when GCOM has exercised a lawful authority that it has, that you're going to interfere with the exercise of the discretion. The discretion is lawful, it's not plainly wrong. And you could only set aside in JR proceeding, which is a judicial review position, if process is not followed. But the procedure, it can't be put before the court. That's the law. No deliberation in GCOM meetings can be introduced into a court. So I think it's 6.5 dozen. We have the looming issue of jurisdiction, which will probably achieve the same result by a different method. If the court is to decline jurisdiction in the matters, it means GCOM has the free rein to continue the recount, which they had decided to do. They had ordered to be done. So either way...
You just answered the question of somebody else who said, well, or decides it doesn't have jurisdiction. And thank you for that clarification, because I was going to ask
all of it goes. It goes back to GCOM's last position, which is the ordered recount, which, as I understand it, every political leader wants. I don't understand why one person in a party that wants it doesn't want it. The beggars belief. But these are very interesting times. I really hope the resolution is quick and within the next few days. The arguments are likely to be finished on Friday, all things being equal, so we can expect a decision shortly thereafter. I hope, you know. So, thanks for having me.
Thank you.
I have to tell you a little aside, you know there's a Cara pub quiz that I'm associated with to do it. We've taken inspiration from you. We're all locked home. So tonight we're trying it this way. So
Okay.
I'll let you know how it turns out.
Very good. Thank you so much, and
All
I'll
right.
certainly call you
Take good
again.
care. Frank, good to see you. Take good care.
You too.
And Neil, how are you doing? Good to see you. Take good care. All
To our
right.
viewers out there, let us say good night to Mr. Sanjeev Datadin,
right.
and
Good
let's
night, all.
welcome. Good night, Sanjeev. Let's welcome Dr. Neil Parsan, who was he is more of a global guy, a global person that's been in business and medicine, but he also has the Caribbean close to his heart, and of course Trinidad and Tobago very, very close to him too. Dr. Neil Parsan, welcome to our program.
Thank you, sir.
And let me also welcome Dr. Frank Anthony, who has also been well known and today he's not wearing a political cap at all. Tonight he's wearing the cap of a concerned medical practitioner in Guyana that wants to see the betterment of our country and our people. So tonight we are going to go on a short commercial break now. After which, when we resume, we are hoping to be joined by Dr. William Krow, the head of PAHO WHO, in a couple of minutes. These three sage gentlemen will take us through the discussion on COVID-19. Ladies and gentlemen, please stay in tune for a discussion on coronavirus disease immediately after the commercial break.
Looking for an Attention fellow Guyanese, no need to go into person anymore to book your flight. Book your flight over the phone with a Travelspan GT agent. Once you finish booking over the phone, our agent will give you a payment center close to your home. That's right, no hassle for travel anymore. Travelspan is making it convenient and easier for you to book your flights. No need to travel to the office. Call Travelspan GT today for low fares. Call 227-1701, that's 227-1701. Or in Berbice, call Rose Hall at 337-4287. Travelspan making it easier. So call 227-1701, that's 227-1701, or Rose Hall at 337-4287.
Well, good night once again. Namaste, assalamu alaikum. Good night to all the viewers all across Guyana, and of course, our brothers and sisters in the diaspora. As we know, across the world, we are having some really, really serious challenges. We all have to be very, very cognizant. On another program today, we spoke about this coronavirus thing, and it's supposed to have been all in the air, all over the place. Viewers, tonight is supposed to have been a political talk show. Every Wednesday we do a discussion on politics on Globespan, compliments of Nohar Singh. However, given the importance of the coronavirus disease, not just to our country but to our world, we have decided to shelve the political discussion. At least we had it a little bit, but go more into the discussion on COVID-19. To our viewers out there and all across Guyana, before I bring on our guests and ask them to make let me also welcome Dr. William Krow, head of PAHO WHO Guyana. Welcome, Doc.
Thanks so much, sir. I appreciate you having me.
So, viewers, here is what. Over the past 6 months and mostly over the past 3 weeks, we have been all consumed with elections in Guyana and what's not been happening with the results and the declarations and so forth. We have become so consumed that took first place. And it was only after somebody died of the coronavirus disease then we all started to be very concerned. As we will discuss tonight, there are many things that we can do. I am not saying for one moment that do not keep your elections and do not keep the election momentum clear up there in your mind. But I tell you what, viewers, it is my personal view that the time has come for us to assess, one, yes, to keep our country and make sure our democratic rights are observed, but two, as a matter of life and limb, as a matter of life, not limb anymore, as a matter of life, there are very, very few precautions we have to take. Very, very few precautions we have to take. And we have a medical team here tonight to tell us that we got to wash our hands, we got to cough and sneeze in our elbow, and we got to stay 6 feet apart from each other or take 6 feet down. So it's much more complicated than that, of course, but I'm saying that the precautions we have to take as a people to keep ourselves healthy, very, very simple. Stay away from each other. Stay away from, be very selfish now. Social distancing is the new term. Today I had Dr. Krow on another program, and I'm honored and privileged to have you again, sir, and Dr. Neil Parsan and Dr. Frank Anthony. Welcome, gentlemen. And Dr. Krow, I would like to have you take the first go on what is happening on the national scene and how concerned you are as the international present resident in Guyana of the coronavirus disease for Guyana and your concerns thereof.
Yes, and thank you, Dr. Mahadeo, for having me. So the numbers that is one deceased and 4 cases alive. I think what concerns me is the fact that we have the airport closed, which causes inconvenience, and then schools closed, which causes inconvenience. And then on top of it all, people are going about business as usual, having parties, having weekend functions and mass gatherings and all that. So I think bothersome is, yeah, we are trying to make some gains in some areas and then negating it in other areas. I think as a country, we definitely need to get serious with this. And I keep saying, if one takes one look at the Prime Minister of Italy and the way he was pleading, we must serious over.
Correct. Dr. Krow, thank you. And I know that about 6 weeks ago, if not more, the PAHO WHO office in Guyana released to the public. Unfortunately, we were all consumed with elections and we pay no heed. But your office would have released to the public information about coronavirus awareness. And under a campaign of Beware, Prepare, Act, you released advisories as to how we should go about and even things about isolation and care and so forth. Sir, do you feel that that there has been any degree of success in terms of getting the information out there across the country, or is there much more work that still needs to be done?
I think there's much more work that needs to be done. It's one seeing some of the process and another processing it, and another even thinking, oh, is this a conspiracy theory or is this something that I need to seriously? I think so. That's one. The other thing is not everybody is or can be reached with posters and with flyers, and probably we need to do more via radio. And also the third issue is I was in Latham. I came across an issue whereby the first language of the students that I met was they learned to speak Portuguese first, and then the American language second, and then English third. So for us, trying to reach them, that means that we had a hurdle in terms of linguistics. But I think basically those are the issues. And then obviously the other thing is, yes, you produce posters, yes, you produce flyers, yes, you all the other health information materials, but they must also get to the people who need them, who can read them, and then process them.
Right. Thank you for that, Doc. And I'm sure as we get into the discussion, we'll discuss more and more of what we have to do. I'd like to, Dr. Neil Parsan, I'll come to you in a moment because I would like your take on what's happening more from a, offshore of Guyana basis and what Guyanese public needs to do, because I know Trinidad all over the world has placed a lockdown on international travel and regional travel. But Dr. Anthony, I'd like to come to you first before Dr. Parsan in terms of your experience, because here is the question that I purposely did not ask Dr. Krow, because he's more of a diplomat, but you're more in the field of medicine and practice in Guyana. A question came to me today to say, Yog, the medical professionals with the experience of dealing with Ebola, chikungunya, and whooping cough, they are not part of this exercise because of politics. So while we don't want to discuss politics, but the fact is the sad state of affairs is because of politics, the people with experience are thrown in a corner. Dr. Anthony, what's your sentiment with regards to how prepared are we and what's not?
Well, thank you very much, Hugh, for having me on the program. I think this is a very important topic. As you rightly pointed out, this is something that is affecting not just us in Guyana, but around the world. We need to have a national response to this. And whatever issues we are having, we need to iron them out and do that early so that we can all make the best preparations to weather this epidemic. What we are seeing and what we have seen so far is just the very early stages. And we have started to take some precautions to ensure that it doesn't develop. Now, if those measures fail, then we have to prepare for the worst case scenario. So whatever skill set we have and wherever they are located, we have to make sure that we leverage them and bring them into the response. And we have to take this very seriously. As Dr. Krow was pointing out, while some measures have been taken, I don't think the population at large sees this as a big enough threat or understand the threat, the looming threat that we are facing. And that is why, although we have been preaching this thing about social distancing, I've seen people, walking close to each other, almost in each other's faces, having conversation. Life is going on as if nothing is happening. And you're wondering, why is it that our message about this epidemic hasn't gotten across? And so one of the things that I would like to advocate is that we really need to have an aggressive program of education, health education. And there are two things connected to that. One, not just to lift awareness, because we want the awareness to be there, but a lot of the health education programs would tell you that while you might be good at helping to create awareness, you're even with heightened awareness, we are not getting the behavioral changes that we want to see. And therefore, it is important that whatever programs we are designing must also encompass that component of behavioral changes, that hand washing that you spoke about, that coughing in your elbow if you have a cough, the thing about social distancing. We really have to design programs along those lines.
And also it calls for, as you rightly said, Dr. Anthony, it calls for us as a people. Look, whatever government is in place, they can only tell us and advise us. Unfortunately, we get consumed with politics that we forget that advice is advice, whether, whatever is the source. But you can always check with a powerful WHO. You can always check with some independent medical practitioners. Because the key thing is that our personal hygiene and the personal practice, as Dr. Frank Anthony said, of staying away from each other is critical. So guess who? Not to the life of the government, to your own life. So we need to ensure we understand that. And the last thing I'll say before handing over to Dr. Parson for his views on it is this thing with social distancing. And Doc, you can comment on this. Look, stay away from people. Stay within 3 to 6 feet away from people so that the droplets coming out from their mouth cannot get to you. It's as simple as that. Stay arm's length at least 3 feet to 6 feet away. Some countries say 3 feet, some say 6 feet. I would say the furthest away you are, the better for you and for the person. Dr. Parsan. I'm sorry, you're muted.
There you go. Thanks, Mahadeo. Frank, always a pleasure to see you, and Dr. William, pleasure to meet you. This is my third program for the day, and this morning I was addressing the Council of the Americas on this matter. I had the former Minister of Health of Costa Rica. We had some Mexicans and head of the Center for Global Development based in Washington, D.C. on the line, given an overview really of Latin America, and I was putting the Caribbean into perspective. The Caribbean, and when I say Caribbean, but in absolute terms, Guyana is part of this equation. I am a bit disturbed, to honestly hear that the level of seeming preparedness in Guyana is a bit disturbing to me, particularly coming from the information that was dispatched from WHO and PAHO to the country. This matter is very, very serious. We have an opportunity in the Western Hemisphere, late for a few, but others have an opportunity to learn from the mistakes of other countries, particularly in Europe. Yesterday, Spain's time, 738 people dead in one day, surpassing Wuhan, China. Those figures are alarming. So we have a chance to be in front of those by flattening the curve, and we have heard it. My concern is any government in the region's ability to test. Certain governments have set protocols in terms of, waiting for travel history, looking for symptomatic patients. I'm not a fan of that protocol, although initially they listed their protocols for governments to follow, and there has been a prompt at a common response from several Caribbean countries to do this. My concern, test. And for the citizens, home. At some point, Guyana will have to get to that point where Trinidad has been absolutely encouraging its citizens to stay at home. Unfortunately, I'm not seeing the level of comfort from that request from the citizenry as yet to really heed the call. William, you're absolutely right. People are still going about their business. It's one point closing schools. It's another thing saying stay at home, but having government offices open. People obviously have to go to work. They're concerned about their well-being. So this is a very fine balance between the economic interests of the country, public health of its citizens. And I feel very strongly that we have an opportunity to learn the recent past, that is, and put measures in place, if need be, shut it down. We cannot afford for politics to be part of this equation. This is non-discriminatory. We have seen societies as mature as Holland, where the prime minister has put in a member of his opposition as a new minister of health to solve this problem, parties working together. That sort of collaboration is needed with governments, with the private sector, with NGOs, civil society. All must come together to deal with this issue at hand. It is not a political issue. Prince Charles of England has it positive. It does not discriminate. Political class, wealth, it is an invisible, highly intelligent creature destroying all of us. And we have to face that reality. The time has come, I think, and I made this call this morning, for the global community, given the cross linkages economically, and now just as a basis for humanity. We have our own citizens. The government made a decision in Trinidad and Tobago to lock our borders to nationals and non-nationals. I support that call because we have to take all measures to make reality and protect our citizens. But it's quite unfortunate So it's a matter of, balancing all this and coming up with a solution that is proactive, truthful, and we are on a tightrope of trust and mistrust with what is coming from political directorates versus what is optimal for the well-being of our citizens.
Correct.
So I would stop there for a moment and give my colleagues an opportunity as well to.
Thank you. Thank you. And Dr. Krow, today, I'm pleased to tell you this, sir, because you and I spoke a bit earlier today. And the last time we spoke, I had expressed some concerns to you that one of the commercial banks that I knew of, that, there were 100 persons in a room. And, there was no wiping of the counters and the usual things that one would expect. And the tellers were not adequately covered in my own humble view. And I was asking you whether some firm action can now be taken on things like that. I'm happy to tell you, sir, that I think, I've received messages, I've received calls that there seems to have been a change. And like Scotiabank, the other bank is now putting lines on markings on the ground, ensure that there's a small number of persons within the confines of the room. And I guess the staff would have to, understand the risks they're at. Sir, Dr. Krow, while you're balancing between your diplomatic position in terms of making a call for what's right for a country vis-a-vis the political and other players, would we be right to advise citizens who are working or who lawyers insist that they must come to work? Shouldn't this be a time when the employers must also take their own lives in their own hands, understanding that the economics is a different matter?
Well, thank you for the question. I think, for me, it's two-pronged. What do I mean by that? I mean, you would want to make sure that the company that you belong to survives. That's one. And we also want to make sure that the human beings, which is the greatest resource of any company, also survive. Mm-hmm. So what I tell persons, don't play truancy. Make sure that if you are working from home, you're working from home so that your company can survive in terms of the commerce of it, making sure that the survivability is there, so that when the crest is over and the numbers begin to slide down, the organization can thrive. Because we also don't want a situation whereby everything is at home, everybody is at home, and then doing nothing, and then the organization collapses. Whatever organization, if it's my own firm, I'll be thinking about the firm. So that both have to be thought hand in hand, because in surgery, and I'm glad I have colleagues here. At least when I used to practice, we had something that we say surgery successful but patient dead. You don't want the surgery to be successful, and then at the end of it, the patient is dead. So you have to titrate both. Now, the other thing that I would like to also put in perspective is social and physical distancing will not discontinue the transmission of the condition. Social and physical distancing buys us time. It only buys us time. Why do I say that? Because if I stay home and I have the condition, I have it home, I can still spread it amongst my family at home, and we'll keep it at home. After social distancing, the next phase then comes in. And what is the next phase? The next phase is find the positives, isolate the positives, treat the positives, and reintegrate them into society. And that is, when we combine these two strategic approaches, then we can safely control the condition. And
Are we ready for that? I mean, I know our health system is not that robust. Are we able to say that, okay, if we have a country locked down, and I'm using that phrase guardedly, Are we ready to do testing across the country or in facilities, in your view, sir?
Yes, I think what is happening, and just this evening we're debating whether the country should go with the FDA and look for the new molecular testing, whereby results can be received in less than an hour. The problem that we have, and I'm being very frank, is when WHO wanted to release testing kits, and especially the molecular testing, the US decided to go on its own. The rest of the world decided to go with the Germans. And so WHO is now pushing the primers and the probes and the perishable supplies that were developed by the Germans for coronavirus. Now, so that is one. So that is one issue. If we really want to be on top of it, then we have to relax a little bit the criteria that we use for testing. Now, the criteria that we use for testing is very strict. You must have fever and cough, fever and difficulty breathing, and must have come in contact with somebody who had COVID-19, or travel to a place that has COVID-19. And now we classify all countries as places of interest. It's not only China. Look, correct. China, the last 4 days, China had 0 new cases. In fact, China has now begun to declare imported cases. So I hope they are not importing any cases from us. But that is the situation. So we definitely have to look at the two strategic prongs and what we want to do. The other thing, and I want to be brief, here, we need to test more people, and we need to go beyond the strict classification given by WHO. And I'll tell you why. We have 5 cases. I think 2 or 3 of them, of the cases that we had, didn't have any symptoms. The only reason why we tested them was because they were related to the index case. Yeah. So if it's true, then we have to do more. We have to go beyond. But molecular testing is also expensive. So we have to find a way of using some screening testing. Now, WHO has 12 screening test kits for evaluation. So far, our epidemiologists tell us that none of them meet the rigors that they would want to say that it's WHO pre-approved, because the sensitivities are low. And for a screening test, you want one with a high sensitivity. So I think we have an issue. I think the Americans and they use RDTs that are antibody based and all that. WHO has not pre-approved that, so it's good for use in America. But I think for me, as a representative, I'll champion what we believe. It's up to the country to say, well, thank you, for the advice of WHO, but we are going to go with the Americans. That will be fine with me. But the point that I'm making is that we will have to, at some point in time, increase our testing so that we can get as many people out there. Because, like I said, social and physical distancing only buys us time. It gives us time so that we get all our armaments in place and bombard the enemy. And bombarding the enemy is finding them, isolating them, treating them, and reintegrating them.
Correct. Thank you, Doc. Dr. Anthony, your comments on that, because indeed the question comes as to, and viewers have been asking this, in terms of our preparedness, will we ever be, or could we be, for that element of the testing? Because Guyana is such a wide country. Thankfully in this case, Dr. Parsan, that Guyana is so wide and our population is scattered over a large space of land. So it should be natural that we can be distant. Every home is probably, except in the city. But Dr. Anthony, the whole aspect of testing and your take on on the private institutions, because I saw today a release that said that the private institutions in Guyana are saying they don't want to be part, or they cannot. They don't have the facilities to provide the testing and stuff like that for persons.
Well, I want to say this. I've been talking to members of the private sector, and I must say that they're very responsive to what is going on in the country. And in fact, as a private sector grouping, they have been holding almost daily meetings, trying to assess what businesses can do, what advice they give to their employees. Some of them have been taking steps of trying to do a bit of social distancing, rotating staff, advising people to stay home and so. And they're even taking the initiative of trying to talk to the minibus drivers and the people who are providing speedboat operators and so forth. So I think that is quite commendable. And I was actually in a discussion with them this afternoon where they were also talking to, or talking among themselves about what actions should be taken with restaurants and bars and things like that. So I think the private sector is extremely concerned, and they also want to play a very pivotal role in preventing or containing this epidemic. So I want to commend them for that. And I think they're starting an initiative where they themselves are also going to be talking to a lot of the private institutions, meaning hospitals, to see how they can leverage their hospital support. So that's a very commendable move on the private sector actors, the various head of the commissions and so forth, and I want to commend them for that. The second thing is that I agree completely with Dr. Krow. I believe that we really need to have more testing done. We haven't been doing a lot of tests because my understanding is that we had a limited amount of test kits. I wanted to commend PAHO, WHO, for taking that initiative. It was through PAHO's initiative that we got our first 30 test kits in, and they brought in a consultant who trained our national laboratory staff about 6 weeks ago. So they were helping us to get prepared. And then while we were exhausting those 30 kits, they took another initiative of procuring close to 700 more kits so that we can have some kits available. Now, the kits that are being used, as Dr. Krow pointed out, are PCR test kits. They're very expensive. And in some cases, it is going to be difficult now to access them because of the large demand that you have around the world. So one way, because you have to use these things first to screen and then to confirm.
Right.
And so basically you're doing two tests. You have to screen and then confirm. And you're using one type of kit, basically. So what we need to do, what Dr. Krow was proposing, makes sense. You can use a rapid kit that would take maybe 15 minutes to maybe an hour for you to get the results. And then, based on those results, you can use that as a screening exercise. And based on your result, if you have a positive, then you go and you use the PCR for confirmation. And that is, I think, a very progressive move. Now, while WHO might not be able to recommend this, as a country, we have to decide what are going to be our national protocols, because WHO would only recommend something after it has gone through very rigid testing. I understand that they have rapid kits that are available that would give you up to 80% sensitivity, which is, I would say at this point in time, is good enough to screen, because you will weed out a lot of people who are not going to be positive. And then those who test positive, we can then move them and do PCR on them. But he is completely accurate on saying that staying at home and the social distancing would buy us some time. But the thing that is going to change the dynamic, as the head of WHO has said, Dr. Tedros, he has said that you have to test, test, and test. And the only way we can do that is that we have to ensure that we have enough test kits and that we are opening up the access to test kits. Right now, there's only one lab that is doing it. That's the National Reference Lab. If someone in Barbados, for example, would need to get a test, then we need to provide them with some site where they can go and be able to get that test done, and so forth. And it goes for all other regions as well, Region 10, Region 2, and so forth. So we have to create that network of where we can send people to get those tests. And if that is not a possibility, probably we need to have mobile teams that we can deploy to persons who are at home and to be able to collect those tests from home and bring them into the central lab that we have that is running those tests.
Absolutely.
So we need to create that network, and you know, we are not short of ideas. There are lots of things that have already been tested and done around the world, and what we need to do is see what works there and what we can adapt to our situation.
Correct. And Dr. Parsan, just before you come on, let me just say this to Dr. Anthony. What we have done from a public service perspective, Nohar Singh, for example, Glenn Lal, yours truly, we have started a daily program. So while I am, and we are all on Globespan's program, thanks to Nohar, I am also on Culture News every day at 2 o'clock. Specifically, and these are all free air time that's put up by Nohar, that's put up by Glenn Lal for us to inform the public on the COVID-19 and make us all aware. So we're trying our best, and please feel welcome, as Dr. Krow is and Dr. Parsan is, to join us in any one of these programs to ensure that we can disseminate, the information out there. Because as Annette Arjun says, the people needs daily update. The people don't need to be wondering what's happening. They need to be informed what's happening, what's the level of risk, and what's the next step. Dr. Parsan, in terms of your experience and your collaboration with international colleagues, we know there is a lockdown on international travel. The issue or the question I will have for you, sir, with regards to all the companies that you would have worked with, not necessarily worked in terms of work, but dealt with, masks and test kits and all of these things, are we not at risk of having a shortage of these things to deal with the Caribbean population? And how then do we move ahead?
Dr. Parson, can you click on the mic icon to turn on the mic?
Yeah. There you go. Thank you, sir, about that. That's a good question, and it relates to the comments being made by my two fine scholarly colleagues here. Frank and William, let me just suggest something to you, please, and I'm saying this very respectfully. Guyana finds itself in a very difficult position. And I'm happy that William made representation of the WHO and PAHO's position on this. The PCR tests are exorbitantly expensive. I have seen tests for $95 US per test. It averages about $150, $170 in the open market. The problem with that is they use a number of reagents that are already in short supply. I work the phones every single day. I'm talking to one of the biggest labs in the United States, and calculation just for the US is that over the next 6 to 9 months, they will be doing close to 1 billion tests. On the estimation is 500 million. 1 billion being screening, and then 3 other tests to make sure that they're out of it if they're to test weekly. So that's where the billion come in. These numbers are huge and tremendously costly. I am happy to hear that the PAHO rep, that William is saying, we need to loosen up a bit on the testing. I have seen kits for 38 US with 95% efficacy. You spoke of 80%. So there's a cost factor, and again, it comes back to the economics versus the. And that is a very, very serious matter. And it goes back to Tedros's point, test, test, test. The mask, absolutely critical shortage in terms of production. Right now, let me tell you how expensive these masks are. Under normal circumstances, a mask is between 8 cents and 15 cents US. Governor Cuomo of New York stated publicly that in some instances, he's being offered masks at 7 US for one. Understand, pre-COVID, 8 cents. Post-COVID, 7 US for one mask. There's an absolute critical shortage. And the number of masks are staggering. In an ideal world, every time a doctor sees a patient, they change their mask. So the average shipment, 50 up to 70 million. I know of one order that went to Europe for 100 million masks. And that's just the mask. We have PPEs, we have gloves, we have the medical garments, etc. The point being, we would be, when I say we, meaning the Caribbean, we are already almost low down on the list in terms of priority. These are changing every hour on the hour for demand and supply. I was advised on the PCR side, just the swab could have a back order of many months. That has serious implications to testing down the road. And the other part of all of this is there are several websites, and I want to make that point about websites and fake news. Tons of it is being circulated over social media. Even the scientific news that is coming out, understand this is so new, enough data has not been collected, and a lot of this data is not peer-reviewed. I would trust certain sources. I would absolutely trust the WHO. I would absolutely trust the CDC. I have learned to trust Johns Hopkins University as a source and others who put out information. But we should be very wary of where we get the information and how we use the information to our advantage to solve this crisis. It is a crisis. And it comes back to the point, Yog, I think it'll be very helpful for the community. There are almost recipes out there on how to actually create your equivalent of a cheap. If it is in short supply, innovation is the mother of all of this at this point in time. There are opportunities for the community to get together and help with it. And I'm happy one of my colleagues touched on the engagement of private sector in all of this. I think they have an absolutely critical role to play. And I'm very happy to see many companies, especially in Trinidad and Tobago. I'm very proud that certain companies are stepping up and not just stepping up, but batting hard at the crease to help solve this crisis together with government.
Thank you for that. Yes, sir.
If I can just make a comment here. I think for our Guyana situation, and I agree with Neil, the guidelines is that if you have a positive case, after the quarantine, you must test 2 times more, 24 hours apart. But, in fact, only yesterday I recommended to the country, if we do not have the resources, and so far, PAHO WHO has given a kit. What we could also do, the guidelines says, we could also elongate the period of isolation by 2 weeks. By 2 weeks when they are symptom-free. So we can choose any. I mean, if we have the resources, let's go with the 3 tests. If we don't have the resources, at least we have a leeway. The only other thing is keeping people for an extra 2 weeks. You can imagine you've kept them for 2 weeks, then you keep them again for 2 weeks, and that creates some confusion. Someone told me because there are some push and shove issues going on in terms of, Guyanese have been stranded in the US and in Europe. Please allow 1 or 2 planes to come in. When they come in, they have to immediately from the airport go into isolation. And then someone tells me, Guyanese, at least the well-to-dos, they wouldn't want to go into isolation. Then you don't come. We have to be serious. You come in many countries, you arrive from the airport straight to quarantine. If you don't have the disease, you go into quarantine. If there's evidence that you are infected, you are tested, and if positive, you go into isolation. So I think we need to be serious. So that's one. I think the other thing is, I keep saying, me as WHO, I wouldn't be able to sell any other, or I cannot sell any other. And I'm glad that I have colleagues here who also respect WHO items. I think for us, the RDTs that are there must meet WHO guidelines, and if they do, I will recommend. The fact that I do not recommend an item does not mean that it's not good. It means the country can on its own say, well, exactly. Thank you, William, but we are a sovereign nation. We will decide on our own. And these things happen all the time. I've been in many countries that I've been told, thanks for your advice, but no thanks, and they go on their own way. My duty after that is, how do I mitigate the effects of what I think would have been untoward in terms of the decisions taken? So I'll always be here to support, and I also agree that the items that are coming from WHO are free of charge to the countries. In fact, the very first one that was set up for the lab, I immediately, without even waiting, I immediately ordered the second set, and that's why we gave the second set 2 days ago. I am hoping that UNICEF is on board, and UNICEF has also ordered their own that we are supposed to be getting in April. So I think we are fairly well covered, but we must test and test and test. The only thing is, we will have to relax a little bit the WHO guidelines, because we have strict guidelines. Category A, Category B, you go straight to testing. Category C, you have to do the influenza A and B test. If they are negative, then you go on to COVID-19. We have strict guidelines. So I think those strict guidelines are also restricting us. Like I said, we've picked up a few that were positive that I wouldn't have. Even the index case, when they told me about the clinical presentation, I said, no, don't bother about it. Don't test. This is someone who has ENC. So when in the evening they told me the results, I was in shame. But such is life, and such is public health. Over.
Right. So here is what I mean. I know that in the past, Dr. Adegron, I think you might have been here about 5 years now in country. But I know in the past. Well, there you go. I know in the past, and Dr. Anthony, you would have certainly been here. I think some time ago you would have been heading some agency through some of these things. I think in 1992, Guyana had cholera. In 2007, we had the whooping cough, and then we had the chikungunya issue thereafter, or sometime in between. We managed as a people to have risen up to the challenges on those things that were new to us then as a people and as a medical system too. What is so different now? Why? I mean, I know that it's completely different things, but why is our health system not as robust that we can respond properly to things, of this nature? And of course, I know it's a lot to do with politics and stuff like that, but Dr. Anthony, what's your take? And what will it take for us to get there?
Well, I think what you described, the outbreaks that you described, they were not pandemics. What we are facing is a pandemic, right? What we had was outbreaks or little, I wouldn't even say in some cases it was an epidemic, but we had outbreaks and we were able to deal with it. What we are talking about is something that is different. While coronaviruses have been around for a long time, what we are dealing with now is a novel coronavirus that has, it might have about 86% of its material relating to other coronaviruses, but that novelty that we're experiencing, the global population is experiencing, it's because we have never seen it before, and that is why we have no immunity. That is why it's going through all these populations, right? Yeah. And that makes a big difference. And also, the mortality that we are getting is very, very high, right?
Yes.
The group of people that it's affecting. So there are characteristics that we are seeing where this has started. We have seen how this has progressed in other communities, and we can learn from that and respond to it so that to mitigate the problems that we can have here. You know,
Right.
a lot of people are talking about flattening the curve. What does that mean? Because if we allow this thing to run its natural course, we are going to have so many cases that it's going to overwhelm our fragile health system.
Right.
And if it overwhelms our health system, then we are going to have serious problems.
Correct.
Right? So we don't want that to happen.
I want to direct two questions to you. I don't know if you can see them there. And any one of you can pick it up. Dr. Neil, you too. Gargi Sitaram has asked, is it an airborne disease? We want to take some questions from viewers out there. And Anita has asked that MOPH said you do not need to wear a mask unless you're having symptoms or tending to someone with symptoms. But shouldn't we wear masks also to prevent particles getting to us?
Well, the thinking basically with masks is that if somebody, first of all, why are we using the mask? One, if you are in a healthcare institutions and you're offering care or you're going to be in a room with persons who are, confirmed cases and things like that, you need to protect yourself, right? So that's one set of conditions where you would need the mask. Now, if you're also having upper respiratory symptoms, you're coughing and so forth, it is advisable that you wear a mask so that you can protect others, right? So that's another way that you are being responsible. But for the average person who is walking around and putting on a mask, a lot of the studies have shown it doesn't have much of an effect. And I was reading an article just this afternoon that basically said that, if you're wearing masks, you're supposed to change them every 20 minutes or so, or else they're going to be soggy and they're not going to be as effective. Now, if you're going to be doing that, that's consuming quite a lot of masks. And as Neil had pointed out earlier, we are right now short of personal protection equipment. And we need to allocate those personal protection equipment where they're going to have the best value of preventing infection or preventing transmission. And that is one. If we have a lot, well, then maybe we can do other things. And I know some people are advocating that we can do it on.
One of the viewers have countered with the following, that if they feel threatened going into any place because they don't know who may have the virus, who may not know that they have it themselves. And so they could be shedding unknowing to themselves and others. So shouldn't you wear a mask to protect yourself?
And that's why if you're keeping that safe distance, if you are observing the social distancing, and even if that person coughs, then those droplets are not going to contaminate you. If you wash your hands regularly, even if a surface has been contaminated and you touch that surface, but you wash your hands, you are preventing that transmission, or you're breaking that transmission. Even if you have it on your hands, but you don't touch your face, your eyes, your nose, you're still breaking that transmission. So the simple things that have been put out there that we're trying to get people to understand, if people follow those simple rules, we are going to be able to prevent some of these transmissions going forward.
Right. And of course, viewers need to be reminded that, as Anita Arjun has posted, that she's also concerned and we need to be responsible with the disposal of the gloves and the masks and everything we do. It's not just something you take out and throw away. So we need to be very, very, very careful. Yes, you were saying, Dr. Alko. Dr. Parsan, feel free to join it at any juncture too.
Yes, when Dr.
Let me say one or two things about the mask. There are differences between the surgical mask and the N95. The surgical mask is a mask that has the 2 or 3 pleats that you see normally. And as Dr. said, it's a mask that surgeons wear when they are doing surgery so that they don't breathe into the surgical area. So that that mask, when you wear it, you prevent others from getting what you have. Now, the N95, the name N95 means it prevents about 95% of the particles from getting to you. The N95 is the type of mask that you wear that prevents others from giving you the condition. So that's a major difference. Now, having said that, people who wear masks, in fact, it is not necessary. Why? Because as you wear masks, they collect particles, bacteria, viruses, fungi, anything. They collect those particles on the mask. And if you don't treat them properly, if you don't dispose of them properly, and you handle them, you are rather going to introduce them straight into your body. And that's why it is not even necessary. So that's by way of the mask. Let me quickly also say you mentioned 2005. I think 2005, people see the calamity, what is there. They see they see the floods everywhere. They see that somebody's got leptospirosis and died. So people took action. Here we are. MERS came, which is another type of coronavirus. It didn't touch us. SARS came. It didn't touch us. So people are believing God is truly a Guyanese. It's not going to touch us, and that's why they're behaving, the way they are. Now, the third point that I would like to make, and you also alluded to that, is the issue of the aerosol. I think Frank mentioned it. To date, the data that we have shows that it does not travel as an aerosol. It is not in the air. Otherwise, it's not going to be only person to person. But if you are in a group, in a hall, and you're not even in contact with somebody, you can still get it. No, the etiology and everything that we are seeing, the dynamics of the disease, plus the data that we are gathering, show that it is not aerosol spread, which is a good thing. So that means that it is just by droplets from our coughing, from our talking, and if we practice hand hygiene and physical distancing, we should be able to thwart it for a while. Over.
Thank you. Dr. Parsan?
No, I associate with all the comments made by my colleagues. I mean, WHO has some very clear guidelines in terms of who should be wearing a mask. If you're taking care of somebody who is COVID positive, they advise to wear a mask. If you are infected, they advise you to wear. But if you're wearing a mask, totally agree with Frank, know how to use the mask. But it's not just the mask, it's everything else. Hands, social distancing, etc. And most importantly, this is where the error comes in, how to remove the mask. Because you could physically take your hand and go in and actually be transmitting to mucosal line surfaces. And I am happy that William brought up the point, because the point on nebulization or the aerosolization of corona as an airborne virus is up in the air. So I think keeping a very close eye on the data, the science behind it, and the confirmation that it is indeed an airborne disease. One particular WHO official did make the statement. Others came subsequently and made comments behind it that probably suggested in it a bit more science is required. Listen to the authorities, take heed of the instructions, and follow official information of truthful, factual information.
Right. So Dr. Krow, a question from David Khan. Simple but pertinent. How long does a droplet stay in the air? For, what's the average concern?
In fact, because of the fact that it drops within 3 feet, it drops on the ground. It depends on where it drops. You may have already heard that those persons who were on the Princess cruise, after all the passengers were removed from the cruise, 17 days after that, they've still found coronavirus particles on the ship. So it definitely depends on where it falls. In fact, if it falls on plastic, it's supposed to last about 3 to 4 days. And now that the Princess cruise ship is giving us more details, it looks like there are many other factors that may be in play. So definitely it falls less than a yard, and depending on where it falls, it may be a few hours or it may be a few days. And in fact, some people have come out to quantify, and I don't know how scientific it is. They've quantified if it's steel, how long it will last, if it's copper, and if it's plastic. I don't know about fabric. So we have that data, but that data is not corroborated.
Correct.
But there's another interesting thing too. The longer that it survives on an external surface, there's one study that is showing that the infectivity, if you like, the infectiousness of it would drop. So that's correct. That's another part of what is out there.
So repeat that for us, Dr. Frank.
So if it's going to be on a surface maybe for 4 days, then the infectiousness of it would drop, in some cases by 90%, right? Okay. So if somebody who is positive, they sneeze, right away it's going to be highly infectious. But over time, it would lose that ability to be infectious.
And perhaps, Frank, we should explain to the listenership that what that means is the ability of the virus to physically enter your cell is the definition of the infection. And it comes back to a point. Some officials are using the term mild corona. There's nothing like mild corona. There's coronavirus mild symptoms. Fundamentally different from having mild corona. That term and it should not exist. Just like in my view, in the face of a global pandemic, we should not be talking at this point in time about imported cases. It is a pandemic. It is
correct.
It's like me talking about globalization. Globalization has come and gone. So I just want the viewership to be aware of these terms and understand its technical perspective to understanding of when they read information and so on.
Right. Well, thank you for that. And I must say this, that I am proud of a number of things that we have done as a people. I'm sure that Dr. Krow, you and Dr. Frank might have known. Dr. Parsan, I want to share this with you and our viewers out there. The religious community in Guyana has called and advised all worshippers and devotees to not to congregate at the churches, mosques, and temples. They have called on all religious groupings to observe your personal space, which is 3 to 6 feet apart, and do your worship at home. In fact, I'm very proud of the Hindu group, the Hindu community that is. This is a period of Navratri all over the world, and in Guyana, it is a special period in which we assemble at the mandirs usually, and we do fasting and prayers over 9 nights and 10 days. However, I'm proud that a group of priests, Hindu priests, have taken to social media and television and radio, and they're transmitting, they're broadcasting, sorry, is the right term to use. They're broadcasting the Navratri prayers via television, radio, and social media so that persons can sing, chant, and pray at home. You do not need to assemble at the temples, all in an aim to help us achieve our social distancing. I must also say that the banks, I know Scotiabank has led the way on this. The banks where people assemble to get their monies, and so they have started to put rules in place. Many of the businesses in Guyana have started. I know some of the government ministries have started to have a shift system. I know that I believe even PAHO, WHO, and so forth have determined critical staff, and a number of ministries have done it. I think UNDP has also adopted that to determine staff go on a rotation basis so that, not everybody is at risk at any one time. So there are things that people have started to do, notwithstanding what some people feel might be a lack of responsibility from top down. And that is admirable. The places, Dr. Parsan, I don't know how this has been managed in the Caribbean, but places we still have complaints, I have received numerous calls about this, is that the speedboats continue to be crowded, the minibuses continue to be crowded, and one of the things Dr. Krow and I discussed today is that there is a recommendation that is being made to the business community to stagger work hours. So not everybody gets off at 5 o'clock and then you inundate the public transportation system. So everything has to work together and we all have to be responsible. Your comment, and Dr. Parsan, you first, in terms of how public transport and stuff, what's happening in Barbados and Trinidad and elsewhere.
We still have the same problem. We are seeing people crowding in buses. I've seen photographs on social media. You know, just today I saw a photograph where people are right next up to each other at PriceSmart, for example. That is not social distancing. And the idea is, my take on this is that these employers, 70% of our economy in the Caribbean is based on medium, what is called MSMEs, micro, small, and medium-sized enterprises. The private sector has a role to play in redeploying their staff and also repurposing their staff based on their unique talents to keep the economy productive. I feel just as after September the 11th fundamentally changed the way, for example, we operate at airports through TSA. That was one thing that came out of 9/11 that forever changed the behavior. I believe that after coronavirus, particularly, I would estimate by September, October, it will fundamentally change the way first world countries operate via telework, teleschool, telemedicine, telecommute. It will redefine our social behavior in the work environment. And it is an opportunity, especially in the Caribbean with small, controllable spaces where the government can create policy that enables these sort of changes to take place. We can actually become leaders in that space. The way we are controlled experimental modules that we can lead by example on this. Transportation, absolutely. Left up to me, I would suggest cut your numbers by half and then stagger how people are seated in the buses.
Correct.
2 and 3 next to each other, one, and you stagger it. That's the type of thinking that should come out of this, to be absolutely proactive in the way we operate. And the truth of inaction, the truth of a government or state's lack of planning would come to bear within 6 months. We would know who was planning and who was not.
Right. Well, thank you for that. And gentlemen, it's truly been a pleasure tonight. I know we have discussed a lot and there's lots more to discuss. We have, we're running down to the closure of our program for tonight. In coming to you for your closing comments as we wish our viewers good night, I want to alert viewers out there, and I want to call, Anita has reminded me that we need to educate the public on COVID-19, educate. And she has called on spiritual leaders and celebrities in Guyana to do a daily social media post. Call out your fans, your followers to prevent the virus from spreading further. It is normal human behavior of the masses to be influenced by public personalities. And I think Anita has a good point there. Thank you for that call out, Anita. Dr. Anthony, your closing comments, please.
Well, as I said when we started, I think this is a very serious situation we as a country would be confronting. And we need to have everybody coming together to make sure that we have a proper national response. We need to look at some of the perhaps weaknesses that we have right now in responding, and we need to fix those. As was said during the discussion, we need to find ways and means how we are going to scale up our testing ability. We have to also make the preparations in terms of our quarantine facility, isolation rooms, and also prepare our hospitals to ensure that we have things like ventilators and so forth. So we have a big job ahead of us, But if we can persuade the public to change their behaviors, as Dr. Adi Krow pointed out, we'll be able to buy some time so that we can be able to mitigate what is going to happen during this epidemic. So I hope that by doing more programs like this, that we'll get more and more people being involved and get that message across.
Thank you for that, Dr. Anthony. I'm going to come to you next, Dr. Parsan. Let me just alert viewers that some people have inboxed me that there is a news media that said that the flight with Guyanese arrived from Barbados, but the passengers were whisked away to an undisclosed location. I certainly hope that if there is truth in that, that yes, indeed, the passengers should be whisked away and put under some quarantine for at least 14 days. Barbados doing it, Trinidad doing it, everybody is doing it. If you come into their country, you are entering into a quarantine system. You are going to get into a quarantine to ensure you are isolated for the period of time after which, of course, or during which you will be tested. Dr. Parsan, your final comments, please, and thank you for being on the show with us.
Sure. I mean, my final comments is just keep what we are doing. I think distribution channels like this could be a good tool for advocacy and awareness. I would plead with you as moderator and to Noah Harris Singh and others to ensure that we have a structured conversation over time. Let's talk about the economics of this, the health of this, the social implications of this. You know, there are a lot of documented studies on the psychology of a pandemic. People's behavior will be changing over the next 10 days. The longer the duration, the greater the severity. People's comfort in being at home self-isolated would have implications on how the state behaves and responds to that type of behavior. It is important that we have that dialogue with the community and keep a very structured set of predictable programs stretched over the next couple of months. This is not going to end anytime soon. I am of the view this is going to peak in May, so we have some time to talk about it. And I would plead that people like yourself and others encourage these sort of discussions and more importantly, open up the channels for public dialogue.
Thank you. Thank you for that. And indeed, I'll tell you, viewers out there, there's so much we have not had the time to touch on today. Look, there are concerns about the prisons. There are concerns about the mental institution, about the PALMs, the old people's homes. There are concerns about children. You know, a lot of people feel that somehow or the other children are not going to be affected. Well, guess what? Latest news coming out of the US is that a young person has died from COVID-19. So everyone needs to take the precaution. We all need to be adults about this and for the sake of our own lives. Dr. Krow, your final comments, please.
Well, have over and over again that this is a ship that is being built, and unfortunately, we don't have the time, and we still have to sail with that same ship. So we are sailing with it whilst building it, and therefore there are going to be a lot of mistakes, and we learn from them, and we move on. I must also say that a lot of good work has gone on. People may not see that, people may not know that, but I can assure you a lot of great work has been going on. Modeling. We've used the modeling that says that by the end of coronavirus disease, Guyana will be having about 1,400 cases. We've used that modeling to look at our procurement. We've used that modeling to look at human resource needs. We've used that modeling for risk communication. So, in fact, we are so working with it. We are hoping to finish that tomorrow, and that will give us a better picture of how much coronavirus disease is going to cost us. Now, the last point, I like the comment that Neil just made, that he sees in his mind's eye that everything is going to peak in May. I have my doubts because China hunkered down a whole province of 50 million. It took them 2.5 months. I think we can do it, but that means that we have to be more serious than what we are now. Otherwise, I don't see it in May. And I'm sorry, I don't want to be the prophet of doom, but we have to do more to enjoy the peakness in May. If it peaks in May, Neil, set up any church. I'll come and join it.
Thank you for that. And of course, I think that Dr. Parsan and yourself and Dr. Frank, they're all saying to all of us viewers that, you know, so much is dependent on us. Well, much more is dependent on us as individuals than is dependent on the public health system. We all have to observe the protocols that are put in place, advisory that is given out from the World Health Organization and other institutions, and then we can hopefully get the testing being done. So viewers out there, please keep attuned to this program and to other programs that are going to give you reliable information on this. Dr. Parsan, I'm sure that between Nohar and I, we are going to take your challenge to ensure that we keep people updated and keep the conversation going. Yes, we need to talk about the environmental impact, the psychiatric impact, all the impact, because a lot of people are also getting depressed being at home and stuff like that. Thankfully, Netflix and some of the sites I don't want to mention on this program have started to offer free, free television, free shows and so forth. But the fact is that across the world, corporates, people are stepping forward, trying to assist in whatever way they can. We got to ensure that we keep our personal hygiene up to date, ensure that we observe those things about coughing, sneezing, keep our social distance, and most definitely, wash our hands. Next week, hopefully, or on another program when we have this discussion, we'll talk more about washing hands. We cannot speak enough about the methodology of washing hands and getting the message out there. It doesn't mean you just take a couple drops of water, rinse off quickly underwater. You know, there's a certain amount of time you have to spend there and rub and scrub and get it done. We will learn from the doctors how they scrub, right? Gentlemen, it's been wonderful to have you tonight, and I certainly look forward to having you in the future. Let me say thanks to Devin Bisoon, our technical operator, to Nohar Singh for making this program freely available to the public, and of course to the Globespan team. All across Guyana, the diaspora, have a wonderful night. Do say a prayer for our country and for our health. Social distance, stay out of people's way and out of their business. Namaste. Good night. Assalamu alaikum.
Thank you.